All right, the flu has been hitting us hard. More than 5,000 people in Ohio hospitalized since the start of flu season. The number of cases continues to rise across the nation now as we're midway through February. So this week we're asking our doctor on call how the flu is impacting us in the tri-state and what you can do to protect yourself. Joining us today is Dr. Robyn Gorman, who's a pediatrician with TriHealth. A lot of schools closed because there was so much flu. I know a lot of kids at my daughter's school went out with it, and it seemed like we were told it's about the same as last year, but it felt like more this year.
Yes, absolutely. So we've seen a lot of flu recently. It seemed to peak in December. We had a wave of the flu with influenza B, which is a little bit unusual to see that early on in the season. Then we had a little bit of a drop in January, and then the last 4 weeks we've seen increasing cases again, so flu A and flu B. So there's still a lot of flu around.
Still time to get the shot, or are we done with the shot?
Absolutely, it's not too late. We expect the flu season will still go on for another several weeks, usually into March, even April or May. So it's definitely not too late to get that flu vaccine.
So has it peaked, or are we in kind of the middle? You said we had December, then better in January, and now a lot more flu cases.
Yeah, there's absolutely more than one peak some flu seasons. So we had a peak in December, and then it seems like we have another peak going on right now in February.
Interesting. So, I mean, we talk about the wash your hands thing, but I guess more critically, it's right before you eat, because that is when, what you're eating comes in contact, with your mouth. Is that?
Yeah, absolutely. So the best way to prevent the flu, first the flu vaccine for all patients 6 months and older, talk to your doctor about getting that. And then washing your hands is another important part of staying healthy. Washing your hands, whenever you're out anywhere, before you come home, before you eat. It's important to wash your hands because you get sick from people that cough or sneeze or talk in front of you that have the flu. But the flu virus also survives on objects like door handles and surfaces, so it's important to wash your hands regularly.
Yeah, you feel like you washed your hands just a few minutes ago, but once you've touched a door handle, all bets are off.
Yeah, germs are everywhere.
What have I missed that you want people to know in terms of the flu season right now and maybe the common questions you get?
I think the important things are really to get that flu vaccine every flu season. It's an important part of staying healthy, and also keeping those around you healthy. So it's for yourself, but also those newborns and people out there that have immunocompromised conditions. So getting the flu vaccine yourself helps to keep others healthy as well.
Okay, Dr. Robyn Gorman, thank you so much for coming in today. We appreciate it. Remember, the answers you hear from our TriHealth experts are just a place to start. This is not a replacement for advice from your doctor. Send us your medical questions anytime. A TriHealth doctor might just answer one on Tuesday. Look for a link at wcpo.com/doc on call to submit your question, and we answer one every Tuesday.